So neck pain is extremely common, and much more so in an environment where we're sitting too long, or we're texting too long, or we're involved in funky car accidents and all the rest. And what I want to just do is talk about some basic causes of things that your chiropractor will be looking for. Quite honestly, here you have this big bowling ball size shaped head on top of this fragile cervical spine that has free range of motion, because from here down you have ribs that stabilize things, but up here you have full mobility largely. And when it's exposed to stress, strain, there's inflammation in the tissue, maybe you could even torn some tissue, and let's say a whiplash, and that heals stiff with inflammation, then you lose your ability to move that joint. No different in the neck or the mid-back or the lumbar spine, but let's say you have a spine, you really want it to be able to bend forward and bend backwards and bend to the side, and all these joints contribute together the same. You can't really see this, but rotation left and right. All those cardinal ranges of movement are something we test for. So if maybe we feel like, oh boy, that pain is right at the 6th cervical, you can left side bend, but boy, you're really locked up in right side bending. So the point would be to enhance mobility. Let's say it looks like that red zone right now, and you get your chiropractor to set up gently on that area that's restricted, and they give a little thrust. And as you do that, that joint capsule opens and stretches, and the gas that's in that area turns into, actually creates the pop, and the formation of the gas bubbles actually what elicits the sound. So they'll give a little, open that up, and all of a sudden you have greater range of motion. Now, having said that, the neck rarely operates by itself. If you have a lot of upper thoracic pain, or a kyphosis, a forward head posture, or your shoulders are hung forward, you're never going to get rid of your neck pain unless you learn how to normalize your posture and to bring your neck back. And these guys tend to get weak, so you got to strengthen your neck flexors and those types of things. Sometimes the low back, the pelvis doesn't glide and rotate, and that puts the neck at odds. So sometimes my patients with neck pain, I have to treat their neck a little bit, mostly their low back and their mid back. So the point being is, it's all about mobility, getting that red area to move again like this. And we also have lots of things to do with regard to strength training and normalizing your curve in your neck and things like that with traction devices that we recommend. So you're in good hands here if you're coming in with neck pain. Thank you.